My name is Nuris Lampe. I'm a dermatologist. I've been working for IELLIOS and Iron Magna for a couple of years, more than 5 years now. And I have extremely very good results with the treatments for my patients. My patients are mostly medical patients who need lymphatic drainage, wound treatments, and pain management. So in those three areas, I have succeeded a lot with my patients.
These are some of the pictures from your patients, Dr. Lampe.
Yes, this is one patient who has a big inflammation and necrosis on her face. And this is a patient after 6 treatments where we have recovered whole of the skin, and the only thing we are trying to remove this moment is the skin wetness. That's the last thing we need to recover. So after 6 weeks, 6 treatment, sorry. 6 treatment, we have achieved this very good result.
Okay, you had some other wounds as well. Oh, the hands. You had these hands that you were looking before.
Also, you can see this hand. This we treated, and this is untreated. And you can see the hands. Yes, the big difference. And then you can see both hands treated, and you can see the improvement of the wrinkles and the elasticity of the skin.
And also the veins seem to be much.
Yes, because the elasticity, it's much more collagen.
It's not as strong.
No.
And you had some other.
Yes. Also we have this patient who has had liposuction, and she developed several of these wounds after the treatment, and necrosis on her stomach and on her back.
Wow, that's from liposuction, huh?
Yes, it's an infection, and become an illness.
That's nasty.
Yes. After the treatment with IELLIOS, you can see in a close-up where you can the recovery of the skin, and you can see even the hair coming back. That means the skin is nearly totally recovered, even the hair follicles.
Wow. That's extraordinary.
So we have anything else? Also, I want to show you this face. This patient has a belt palsy, and that's a paralysis of her face. And this one was recovered nearly totally with about eight treatments.
That's the eye. Yeah. Oh my God. Totally different. Yeah. Wow. That is quite amazing.
So with IELLIOS and IELLIOS, we have achieved very, very not only good result, also quick result, because the time frame is very important, so the patient can go back to work. So we have had extremely good result with these machines.
And also with pain, you had very good results. Yeah?
Yes, but when you see this patient with the bell palsy, it can tell you how quick you can recover the nerve function. So that's why pain is also a very, very good example. But pain you cannot measure. But we can have a recuperation results very quick. Like in 2-3 treatments, the patient's pain will go away immediately.
And that's about a patient that has diabetic wounds and could not feel his leg, but after the IELLIOS treatment was able to feel the leg, right?
Yes, one of the treatment we does is neuropathic, diabetic problems, and we have patient that has which we have given them treatment. We have given them treatment with one leg to recover ulcer, and we recovered the ulcer. But we also recovered the sensation. So the patient was at the end of the treatment could feel his foot, and and uh, and you can even compare it with the non-treated foot, where the patient was saying, "Well, this one I'm feeling now, and the other one I'm not feeling yet." And so we have to treat both of them. But in other words, we can even recover diabetic foot um, in diabetic foot in all his levels, in all his degrees, and that circulation, neuropathic pain, neuropathic sensation, and it's better to treat the patient when this symptom starts, because then we'll go away quickly and they won't progress to what we call Charcot foot.
And that's the IELLIOS or the Magnum or both?
IELLIOS mainly.
IELLIOS. Yeah. What about the Iron Magnum?
The Iron Magnum, we have done a lot of lymphatic drainage in what we call therapeutic facility, or for a patient who had post-operation, like liposuction, patient who have like lymphedema on their legs, patient who have facelift. So we have had all these kind of drainage of a lot of liquid in these patients in a very short time. As I said,
it's a kind of a necessary process for plastic surgeons, you would think, right?
But plastic surgeon is a very good tool, and it's because the patient, most of the patients who comes out of surgery, all of them have a lot of liquid, a lot of lymphatic liquid into their tissues, because it's fat that we're touching. It's we're going into lymphatic system, trying to remove all this fat and blood. So all that is have to drain, and if you have this machine, that will drain in short time, and of course you avoid infection, because that's what we fear always, is about post-infection after liposuction, like the patient who had the liposuction with his plastic surgeon and had the necrosis. If he would have had the machine, he would avoid all the infection.
Thank you very much.